So if you are working, for example, in a factory and you are on assembly line, that assembly line requires a repeated movement. So that means you're putting the same movement over and over and over again. And after a certain period of time, that can cause an injury to a shoulder, for example. So you have a rotator cuff injury, or you have something that's related to your repeated movement that causes wear and tear on the same muscle over and over again. And eventually it causes an injury. So somebody else could be sitting at a desk and they are not sitting in ergonomic seating, or their workspace is not ergonomically correct. So that causes a neck pain or a lower back pain. So work-related injuries really depends on what kind of work you do. The first thing I do is I get a job description from you. So you tell me what kind of job you're doing that demands what you need to do and what are the optimal abilities to do that job. So our goal at the end of the day is for you to go back to do your job, right? And to do a job without risk for you, and at the same time doing it properly for the workplace that you're doing the job for. So we try to analyze the work environment, sometimes on site, sometimes you just tell us in the clinic what you do and we try to figure it out together. And once we come to that conclusion, then we start our work putting together our plan of care, how to decrease the pain, that's for you, how to do it properly, what is the correct ergonomic setup that you need at work to do this job without hurting yourself, prepare you to go back to your work. The first thing is you want to do incident report at your job site. So you want to make sure that your supervisor or the HR department, if you have an HR department in that place, or the owner of the business, if you're in a small business, what happened to you and how it happened, and how it has happened on the job site because of your work. That's the first thing. So you want that documented somewhere. So it's a work-related injury. So that way you are compensated properly, and your therapy and your treatments afterward are covered by workman's comp. And after that, you go see the doctor. It could be some medical entity that your job send you to that particular doctor, or you go to your primary care physician and they see what's happening with you. And after that, usually they prescribe physical therapy. Then you come to us and we do, like I said, we do our evaluation, and we try to work with your doctor, your work, your case manager, if there's a case manager in the process. And we are always your advocate. So your therapist is your advocate, because we know the amount of suffering that you're having and the amount of pain and the actual condition that we can see from our evaluation. During recovery, the first phase usually is, and that's not all the time, but most of the time, I should say, that they will be off work for a while. They will be off work maybe for a month, for two, depending on the extent of the injury and what happened. And then they go to part-time or as tolerated, so it depends on what they call it, light duty. And then they call to full duty. And during that time, whether you're off completely or you're on light duty or on your full duty, you still could be receiving your therapy or your treatments during that time. So I would say expect a period of time to be off work, work with limited hours, and then work with full duty. What I would like for people to know, that for work-related or even personal injury, things that happen when you have an auto accident or something like that, you may not experience the pain or the problem right away. So something can happen and immediately you don't feel anything. I feel I'm okay. Although you know that something happened, whether you're in a car and the car got rear-ended, or you were involved in a car accident, or you're a pedestrian and was hit by a car or by a bike, something happened. Or at work and you feel that something out of the ordinary happened, or something that caused immediate pain and that pain went away, it doesn't mean that there is no problem. It means that it could be a week later and you start complaining of back pain that get progress. For example, I have a patient that she was driving her car and she was rear-ended by another car, And immediately she really didn't have any complaint. She didn't have any pain. She really didn't complain of anything. And medics, when they came to the accident site, they asked her, and she said, "I'm fine. I don't feel anything." She went home. 2-3 days passed, and she actually was in severe neck and back pain to the point that she went to the emergency room, and she was admitted. And they found out that she has bulge disc in her neck that was significant enough. Later on, about 2 months later, was significant enough that she needed a surgery for that. So I would say make sure that you document what happened. Make sure that, whatever happened with you, that you seek help right away, even if you don't feel symptoms right away, just to cover that part, to make sure that whatever happened to you for sure is related to that complaint that you have 2-3 days or a week later, is related to what happened to you in that accident or that incident at work.